All right. So we will begin. My name is Silvanus Manyala. This is the third session of our career and mentorship talk series. We had started well on a good note, I think, for the first two sessions for topics that were, of course, relevant to most of our current students in the senior level and other students in other universities, including recent graduates. So I usually start by giving a brief introduction as to what these sessions are about, why we have them, and why we feel like as an association, as a fraternity, it's important to take our members through such. From personal experience, I believe it's important to get insights, especially first-hand insights from people in the field who have the most recent and up-to-date, information, and then based on their personal experiences. So this just goes to show the importance of mentorship, and then of course career advice. And of course we believe that it's through mentorship that we can know how to chart, or how to can tread this path that have already been laid before us. And so we'll be hosting a series of these sessions, having speakers from the alumni database, of course, UN, and without, who we think are a better place to interact with our students, especially the senior students, and then, of course, spark some form of interest to what lies in the field of practice, and then also to prepare, just to prepare professionally on what to expect outside there. So some of the topics that we had planned initially include the future pharmacy practice, which we are yet to have. That was our first, as per the concept note. I believe most of the participants have access to it. We've so far done what next after graduation, where we hosted Dr. Marianne. Then we had postgraduate opportunities. We hosted Dr. Nelly and Dr. Barbara. And today we are having just a brief insights to survival with Dr. Odhiambo. The other topics will be covered in due time, either through virtual sessions or a physical session, as the case may be, depending on how feasible it is from our end. So this is the tentative schedule we've been working with. So far we are in February, March 3rd, and we are having a virtual session. The previous sessions I mentioned was what next after graduation and postgraduate opportunities. So for today, we're having pre and post-internship, insights towards survival. I know most of the participants who are currently in the meeting are final year students. This would be of importance to them. And then, yes, and as I've mentioned, we are hosting Dr. Odhiambo. So briefly into who Dr. Odhiambo is. For those who don't have an idea about him, Dr. Odhiambo, for those who have seen the posters already, is a pharmacist, yes, with a passion for commitment to improving access to quality healthcare services for all and nurturing socially responsible generations through his vocation. He currently works as a regulatory affairs manager at Novartis, based in Kenya, with oversight over 6 countries. He's a board member and honorary treasurer at CAPI. CAPI is the Kenya Association of Pharmaceutical Industry, which is a membership organization that represents the biopharmaceutical companies that through research invent and develop innovative life-saving medicines. Dr. Odhiambo is also the co-founder of Ryculture, Health and Social Innovation, of course, through which we reached out to him because we believe this particular enterprise has been of impact and is, of course, going to still be of impact to most youth. He has a very interesting structure, including the Youth Voices Summit, which I think some of us also managed to participate in. He's the curator of African Pharmaceutical Network, where he works with pharmacists to bring together the pharmaceutical industry in Africa, trying to, of course, just sharing knowledge, policy shaping, and nurturing partnerships. He believes in positive social change and potential for pharmacists to drive change in healthcare service delivery. He was recently awarded as the International Pharmaceutical Federation, which is FIP, Community Pharmacist Section 2021 Champion for Change, and also the Young Pharmacist of the Year by PSK in 2021. So he volunteers in various youth and community programs. He'll maybe mention a few of these during his interaction with us. And he says that he spends his pastime reading, socializing, and making friends. So yes, Dr. David, I'll give this platform to you. I don't know your mode of engagement, but we are looking forward to having a fruitful discussion maybe for the next 1 hour or so. And I'm hoping the participants will enjoy this, and maybe the rest will be joining us with time. So take this opportunity to engage us. Most welcome.
Thank you, Sylvanus. And it's a pleasure to be here with you guys. I know we've taken much of the first 30 minutes not starting the meeting, but you've already outlined the challenges that we are having. I'm glad that we are all here for the 14 that we're in the room. We get to learn something. So, well, when I was given this opportunity to come talk to you guys in terms of survival skill pre and post internship, I was looking at it in terms of whether there's any blueprint and any particular structure on how it happens, and I wasn't able to find any. And then I decided that the best way to deliver this kind of discussion with you is to make it as interactive as possible. That's one. And two, beyond making it as interactive as possible is to make it be based on my personal experiences, because I'm not as old in the industry as some of you might think or might feel somewhere. I'm barely, I'd say, 3 years out of school. I graduated in 2019. Practice after internship started in 2021, January, because I finished my internship on 9th of December 2020 during the COVID year. So it's been 2 years out after internship, but 3 years after graduation. So with that kind of a background, at least, we feel like we're within the same space and we're seeing what do we do moving forward. And for start, actually, I'll just start it with you guys sharing with me what do you mean by survival skills? Why do you want to survive rather than thrive? Or you guys are comfortable surviving? Anybody who would share, when you look at it from survival skill, what do you mean by surviving? Han, Ryan, Michael, Obi?
Yeah, David, by surviving, so I think at some point, the guys need to survive. From a personal story, let me use your story. So after school, you talked about like you contacting a Makove. You see, for that, it was surviving while it was strategic survival. Like at least you know from your point of view, like where you want to be. So I think strategic, actually, it shouldn't be survival per se, it should be strategic survival. So let's say in my case, I'm shifting into partly software and marketing. So at the moment, probably it will be harder for me, like getting into the healthcare tech industry. Probably yes. So strategic survival, in a way, is probably giving myself a chance to be into any industry, even in the car industry and stuff, just where I can get a job, but learn on that, then probably as years pass by, then I can transition into healthcare. Yeah, okay. So I think it should be strategic survival, which leads you to thriving. Yeah.
Okay. So basically, we'd look at it from getting opportunities during this period before you do your internship, and the opportunities after the internship before you get to the level that you say this is the line of work that I'm pursuing long term, right?
Yes. Yes. Let me add to it also. I mentioned some of these the topics we came up with these based on a discussion internally as the executive committee, and one of the things that was like a constant is from experiences that we of our testimonials we're getting from the outgoing graduates, yeah, in the field. Those who during the internship they went like blindly without being given prior information on how to handle themselves, and after that they were stranded. They didn't know what to do beyond internship, yeah, as they wait employment. So some of these challenges that they had, we feel like, okay, this is something that we are also bound to go through. Now, for us not to go through the same, how can we better prepare, for that same exposure, but now having been enlightened prior? Yes, that's the challenges, and then how to navigate the field outside there.
That's great, thank you. So actually, the reason as I was asking that for us to get the perspective from your end, but also to focus is in terms of where are we at? How are we going to that level, and how do you make that move? Because ultimately, I know we are all pharmacists or pharmacy students in this space, and ultimately we are hoping we get well-paying jobs, fulfilling jobs, and we will be able to make a living out of it and make a difference as we impact lives in that line of work. So the question is, how do we get them? And for me, in terms of those survival skills, there are challenges, which is a fact, and you all know there are challenges. And even I know, if being an African, by virtue of just being an African, we already are accustomed to having problems. So those problems are the starting point to our solutions, and the starting point to finding how do we deal with these particular problems and how do we move forward. I think that is a very good side point for us to start off with. So the first thing is, what are the challenges that we are currently contending with? You'll finish your undergraduate program 5 years. You have final years here, right? Most of them, Sylvanus, you mentioned. So for the final years, you've done your schooling, you're finishing your 5th year end year exams. Now you are there waiting for posting or board stage 1 exams. Currently, with the dynamics and uncertainties with Pharmacy and Poisons Board and the Ministry of Health, you're not sure whether you're being posted in the May intake or the October, or even if it's going to be there anymore. So those are the dynamics that you have to contend with. And the only thing that is a constant is you're not going to die because there's no posting or the posting has delayed. You have to find something to keep you busy. You have to find something to do, and you have to get meaningfully engaged in the sense that you're not killing 5 years of studies in campus. Some of us, I know we did it 7 years, and those are the dynamics that we also have to contend with. So that's a reality of life. So how do you go about it? So one of the key things when you're dealing with it, the pre-internship phase first, you finish your undergraduate, depending on the university. I know OBU in JQuat. So JQuat, definitely you're going to plan for stage 1 exams first. So what are the timelines? Because normally PPB is kind of reliable with regards to the stage 1 exams. If you have more than 2-3 months, I think the best thing is to find something that you can get doing. And the other one is, if it's less than a month or 2 months or so, the best thing is, if you're doing stage 1 exams, focus on that studies and find a way to make the best of it. Because that exam, one key thing that is a constant, you must pass it before you get to your internship. And if you don't pass that stage 1 exam, it's like you've thrown your 5 years or 6 years or 7 years of education in university to the drain, because you'll have to wait for another year, or like at least 6 months to go for the second cycle of the exams, because they're normally in March, the other one is in October or so. So you need to dedicate, even if it's a month or 2, to it. If more than 3 months, however much you focus on studying for that exams, it might not be of much value. So get something to do, but at the same time, start preparing, getting the notes, getting the material that you need to learn. Because that stage 1 has the medical microbiology, the biochemistry, the physiology, anatomy. You need to understand all the basic sciences. So you need to be able to do that. So that is an important bit. If you're not from these other universities that are taking the stage 1 exams, and this also applies to those who are taking the stage 1 exams that still have more time, the starting point is, what are the dynamics? Obi, you mentioned an aspect on my life, yes. After this university, immediately I finished my exams and everything, I got a call from the village from my mom, actually. My mom, they probably had discussed it with my dad, and the thing is, you're coming home because we are not paying any more rent, you're done with school, everything is done. So that time the question is, do I go back to the village or not? And if I'm not going to the village, then it means this house must be paid for rent. And I need to find a way that I'll be eating for the next couple of months before I do my stage 1 exams, and before I go for my internship, where definitely I'm hoping there'll be a better pay. So how do I make that happen? And that is where the aspect on networking and establishing valuable networks from a strategic standpoint is important. Because if you have somebody who will be able to provide for you, the dynamics might be different. You're like, well, I can just stay in Nairobi and wait for that. But in my case, I was pushed to the wall because now, that was in March 2019. You're either going home or waiting for your exams, which are going to be in June or so. And actually, they were kind of extended to be starting in July, August. So during that period, I needed something to do. So you have to be open to the dynamics, and you need to understand your context from which you're operating for. And in understanding your context is first, establish where you are and what interests that you have. In survival mode, make calls. And making calls is reach out to the people that you know. And when I'm talking about people that you know in terms of getting an opportunity, something to get engaged on, probably you're talking about it from a data point. There are so many digital health companies which are working in the healthcare space now, especially the pharmaceutical sector, pharmaceutical distribution, pharmaceutical supply chain, e-pharmacy models and all that. The question is, how can you package your skill set to actually fit into those organizations? And being you're just out of school, I don't think there's any company that would expect you to have 10 years of experience and capabilities to be able to design their whole IT system, most likely not. But they would be willing to get you on board as somebody willing to learn and work with them as you improve your skills. So that kind of a negotiation skill has to come in. They say that I'm willing to come on board, but I'm willing to learn as I do the job. And the key thing is I need to be able to get an income. For me, that was clear from the start. I'm going to get this job because actually I didn't start with a Makoviwala. I started with Dr. Mwaniki Paul, the former PSK president. And I called him and I told him, during our KEFSA days, we used to work together. Yes, that is how we started the conversation. And now I'm done with school. And what's happening is I'm either going back to the village or I find something to do. And I don't think the option of going back to the village is the best one for me. So if you can have any opportunity, please let me know. At that time, he didn't have any. A week after, he called me because there was a data entry. So it wasn't any pharmacy-related stuff. It was data entry in a house in his hospital in Kileleshwa. That is Kileleshwa Medical Plaza. Data entry, just filling patient information, the medicines that were being used, the number of visits that they've had and all that, having the records digitized. So that was not pharmacy-related. By the virtue that I made that call, I already got the first opportunity because by doing that work, we're being paid 200 shillings per hour for 8 hours a day. So that's like 1,600. Transport and everything, you'd be making like 1,200 per day. So from the as a supplier, if you've catered for your lunch and you've catered for the transport from Juja to Kileleshwa and from Kileleshwa back to the Juja. So that is the key bit that you need to factor. If you're going to negotiate for your pay and see what do I need to be able to survive. Because if you take the job as a voluntary opposition and you're not able to get the money and you've been given an ultimatum like the one I had, chances are you're not going to finish that month in that house. And the landlord will not understand that you are actually volunteering. So that is none of their business at that particular moment. You have to negotiate and they have to look for opportunities that will help you meet the obligation that you have at a personal level, but also give you an opportunity to do what you need to do to grow in your career. Then after that, I called Dr. Elizabeth Wala and I told her, by the way, I'm currently offering this job and I'm looking for other opportunities because the data entry was going to be only for 2-3 weeks. So after the data entry assignment ended, I transitioned to Kenya Healthcare Federation on that kind of set stage for the kind of development and growth that I've had in the industry from KHF to CAPI to Novartis, and still part of CAPI, and even the initiatives that I've been doing. So that is important. But beyond that, I know not everyone is David, not everybody will call Dr. Wala, not everybody will call Mwaniki. So the first starting point is during your school days. During your school days, most of you in the final years of school are actually having finished your 5th year. I'm not going to take you back to engage with the noobs and do much of the association work where you can network with these people. But you're already at a point where you can still put yourself to do something. How many associations and organizations and networks are available which are professional in nature that can give you the insights that you need to gain, as insights and skills that you need to develop and build your career portfolio? And already one of them is the Ryculture Youth Voices Network. We're having engagements and we're doing some of the work there. So just generally, even in training, do you know how to write your CV? How do you write it? Or are you going to list, I dispense medicines to 30 patients? Yes, what is the impact of dispensing that medicines to the 30 patients that you dispense it to when you're doing your electives? So you need to be able to gain those skills that you can package your skills and package your capabilities in a way that you can sell them to the prospective employers important for you. So that is one of them. The other thing that you need to do is we are in a digital era, and the digital era means everybody and anyone is on the social media platforms. And one of the best social media platforms that I recommend and I still encourage you guys to engage with is LinkedIn. On LinkedIn, you can access everybody and anybody who has ever had a digital footprint. And that means from the president to the cleaner somewhere, from Bill Gates to anybody across the world, like from Elon Musk to anyone you ever think of. So as much as the diversity of the pool of people that you can interact with are as that diverse and complex, it also means in every line of work and every field of interest that you've ever had in your life has a presence in that platform. So can you explore them? You either can explore based on the company that that person is in, or explore based on the person that you know. If you know somebody already and you don't have their contacts, go to LinkedIn, send a connection request. And if that connection request, you can customize a message indicating what your interest is in terms of what they're doing. And definitely one key thing that has worked for me greatly in terms of social media connections and LinkedIn networks, I send you a message, let's say, for example, it's Obiero. Michael, I'll just tell you, hi, Michael, I see the work that you're doing in the digital health space, and I would be glad to engage and see how you bridge the gap between pharmacy practice and the digital health landscape. Maybe if you have a moment, we could plan a 30-minute virtual coffee chat. That virtual coffee chat, you're giving that person an opportunity to talk to you and tell you their story in terms of their career work and their career interests. Most people are willing to take that challenge. And when they're willing to take that challenge, I go into that challenge. One, I know what I was looking for. I was looking at learning what is in their space of work. Two, making a connection at a personal level with this person. And three, exploring opportunities that might exist in that space that I can actually get to plug into. So in that call, that person is not coming into you as somebody looking for a job. Because one of the challenges that I've noticed as well, even for myself, when I see LinkedIn, I respond to all of them, yes. But some of them are kind of, it's a transaction. It's not anything like there's no content to it. It's like, hi, I need a job. Can you be able to link me with one? And you send your CV already. So that is like being a beggar. The key is you are a professional, you are an expert, you have a skill. Can you sell that skill? Can you have a conversation that you can make somebody feel like you have additional value to offer? Because if you make it transactional, like, hi, David, I'm looking for a job, please find my CV. Then you've left it at that point. Do I have any reason to reach out to you? There's no curiosity, everything is already there. But when you create suspense by starting a conversation and having it as a kind of a bi-directional where I have an opportunity to share my story and my experiences and you learn from it, and you're also able to now look at specific touch points in that story to see where you can plug in. There's so much difference and so much impactful work that you can do from that such kind of a conversation. So take advantage of the social media channels and make those connections as much as you can. Then once you know where you can apply those opportunities, the other thing is making the ask. And in making the ask, I know even some of my colleagues, some of my seniors as well, we are suffering from this challenge because in terms of training and in terms of our professional development, we've been accustomed to the fact that we will finish school, we'll get internship, after internship, we'll get posted, and we are experts, we are the brightest in the industry, brightest in the country, and therefore we are guaranteed the next steps of our growth. And with that comes some level of, I don't know if it's arrogance or just kind of being aloof in a way. You don't interact with people, you don't make requests when you are stuck because you feel things should be working out and you actually feel you feel ashamed to ask. Let me tell you for a fact, the easiest way to get what you want is by asking. If you never ask for it, nobody will grant it to you because they don't even know you need it. So when you get into spaces, ask for the opportunities that you're looking for and make it clear that you have additional value to offer and you're also making the ask because you really need that help and you need that support. If you're able to make the ask, chances are you'll get somebody who will respond and give you the opportunity that you're looking for. So from a pre-internship standpoint, make the ask as much as you can, make connections. It's a good opportunity to connect. And it's also an opportunity because at that time, I would call it pre and post-internship immediately. It's a discovery phase. most of us don't even have clarity on what areas of pursuit we are interested in. Am I going community pharmacy, clinical, regulatory affairs, pharmacovigilance, QA? All the options are there. And with all the options available in that space, then you need to be able to get to learn about them as much as possible. And once you learn about them, you now make an informed decision knowing where your interests lie and where the opportunities are as well. Because you might find the opportunities, let's say, for example, in community pharmacy, that is not where your interest lies. But the question is where your interest lie, can you blend it with where the opportunities are? I remember on last week on Sunday when I was in USIU, I was talking to the guys there, and a question was asked in terms of pursuing your passion or getting the job that comes. Get the job, but look at how to blend your passion. And in this case, I was using a case of pharmacovigilance. Pharmacovigilance, patient safety, looking at adverse drug reaction, adverse events and all. Imagine you can build your portfolio as a pharmacovigilance specialist working in a community pharmacy. And that comes by being intentional and being deliberate on what do you want to do and how do you want to do it. Then gaining the skills that you need to be able to do the job. And that is important. From a post-internship standpoint, after your internship, and I think we are skipping a gap when we go pre and post-internship, because for me, the critical phase as well, after your pre-internship phase, when you've learned and everything, you'll quit that job or that opportunity you get to go for your internship. But if you find somebody who is willing to take chance and actually have you do the work with you've been doing pre-internship during your internship as a side job, that is better. For me, that worked because during the COVID period, CAPI moved from office to having virtual work, and that virtual work involved more of secretariat and using my laptop. So during that period, I just used to go to Kenyatta National Hospital with my laptop. In the morning by 7:30, I was in the facility doing the CAPI work on my laptop up to around 8:30. Then 8:39, we're starting the pharmacy, setting up, still cleaning up and everything, setting up everything. Then from 9, we go either do ward rounds. Then after ward rounds, we start filling prescriptions and sending medications to the wards or serving patients through the counters, where depending on the pharmacy where I was. During lunch break, I go back to the laptop, send emails, fill up on any projects, the right concept that needed to be done. And then in the evening, I'll go back home. Let's say I leave the facility by 4:35. I'll be in Juja by 6:37. Then 7, I make my dinner, shower, and take a rest a little bit. By 8:39, I'm back to my desk doing the work again. Because at the end of the day, I know I'm doing both jobs and I find the value on both of them, having both of them. Luckily enough, there was COVID, so the pressures in terms of traffic were not as much, so I was able to balance. You need to see, can you negotiate to do part-time job as well when you get into internship? But beyond that, at the point of internship, if you're not able to multitask and you're not able to do the 2 jobs as they are, you have your full-time internship, which is 100% paid for, and the salary is not as bad. Averagely, it's a decent salary. It therefore means you're able to make rational financial decisions and you're able to balance your life and make a good, decent living out of it. So the question is, what do you do during your internship? And this is my suggestion. You have the money, remember to live. That is important. Don't fail to live that you're saving everything and living as if you don't earn a salary. You have only one life to live, so live that life the best way you can. But don't live it responsibly, in the sense that don't blow away all the money that you get. So that money that you're getting as your salary, a portion, a modest amount of it that can sustain your livelihood, but the other amount is save it. Find alternative financial solutions. There are money markets, and actually I'd give you this financial advice free of charge. Sanlam is the best performing money markets fund at the current moment in the country. So if you find some cash that you want to invest, Sanlam's starting amount is 5,000 Kenyan shillings. Then you can subscribe up to 1,000 every month as you wish. So, and that money is working for you because there's nothing else that you need to do. And you have an app there, you can track it, how the markets are performing on your phone. So that is easier. So if you have that money, you can put it there. And it's kind of staying in that account, but also earning you interest at no extra work, and you're not putting so much pressure on yourself. It will be good for you. And during that internship period, from a practice standpoint, please, please, please do the work. I know at times we wish we get places where we don't do any work. We could ask for pharmacies where they don't want you to come. You come day 1, you're given reporting and completion letter at the same time. You need the industries where you don't need to do the work. Well, there are dynamics to it. So there's one option that you are doing that because you have other things that you're doing. And there's also the aspect of you doing that because you don't feel like you want to do any work. You just want to enjoy the benefits of it. That is already corruption. And we're talking about, we are fighting corruption issues as a country. So that's not right. Go to your clinical pharmacy practice, the 6 months in level 5, level 6, do the work, go to the wards, triage patients as much as you can, fill prescriptions as you can. But most importantly, during that experience, identify at least for the 6 months, at least 2 or 3 cases of a patient dealing with particular condition that you find interesting and intriguing to you. And these are intriguing in the sense that there's a couple of learning opportunities in that. And with those learning opportunities, position yourself as a project manager. And as a project manager, you need to understand what is the problem that this person or this patient is experiencing. From the problem, what is the intervention? It's not only the medicines. I would give you an example. When I was at KNH, there were kids who are coming with leishmania and all that. These are patients who are suffering from leishmaniasis, yes, but beyond the medication that they need, somebody already diagnosed them with malaria in the local community, that's alone in Kidney County. So when they're coming to the hospital, they've been on antimalarials AL for the last 3 months or so. They already delayed management of that care. Then when they're in the hospital, the dad came with 3 children. And the guy is telling you, the last born is still at home, and the mother called to tell me that they're actually also having the same kind of symptoms. So I'm hoping when the 3 of them in the hospital today are cured, I'll be able to go back to the village to bring the other one as I leave the 3. The question is, when you understand from treatment protocol, this is 17 days of staying in the hospital, because when they've already been referred, treatment protocols, sodium glucomate and paromomycin is 17-day therapy. After that, it means that patient might be given another day, or even the diagnosis didn't start on the first day. So it was the 2nd day or so. They were already admitted. So that is 20 days at the bare minimum. They're in the hospital. They go home and come back. Are you even sure they'll be discharged? Because there's payment to be made. This person is a peasant farmer, basically doing day-to-day job to be able to fend for the family. Will he be able to pay? And if he's not able to pay, who will go for the other kid who is in the village? As a project manager, you need to be able to understand what are the different dynamics, what are the health system pillars, how do they contribute to this? And you write even a paper on it. Who are the probable stakeholders that you can call on? And if you're able to come up with such kind of a solution, you're already developing your project management skills at an institution where nobody expects you to be right. And every pharmacist or senior colleague that you're working with, whether doctors, nurses, physicians, like whoever is in that hospital, is willing to guide you and support you when you're asking questions. And even the people who are not working in that hospital are willing to talk to you and listen to the case that you're managing. Can you be able to develop such kind of cases and try to bring interventions where they might not be the clinical, because in the hospital, you just give the medication and leave it at that. But if you're able to draw it from there to see what interventions in the upstream or downstream approaches you can deliver, you're building yourself and building your professional portfolio. And the reason as to why I'm keen about writing, I know most of us don't like documenting stuff, but documenting helps you at a professional level in terms of building your skill set, because there are a couple of opportunities that I'm actually exploring where I am. And most of the time they're looking at what are your previous works. And the evidence of your work will be from a publication, from an article, from anything that you've done. So do you have that evidence of it? And if there's no evidence of whatever you've done, nobody's going to count on you. And if nobody can count on you, then it means the opportunities that are also made available to you are diminishing as you move through the journey. So it's good to start documenting as early as possible. So during the internship, do the best that you can. Primary healthcare. Primary healthcare, the best solution that you can offer, actually being it in a primary community level. Health education, and you have the information that you've studied for the last 5-6 years in school that is available with you in your brain. Use that information, coordinate, even talk with the clinician in charge, because most of the primary health facilities are led by clinicians. And we just have kind of, let's say, for example, weekly conversation with patient education programs. And then patients will just be notified and they'll be coming. How they make it, I also don't know, but patients normally come. I remember when we was in Kasarani Health Center, we had this NCDs clinic that we started, and we started it when I was there. That was in August. Over the period that I facilitated and actually participated in the clinic program, we had patients coming up to 50 sometimes, diabetic and hypertensive patients. And by interacting with them, you understand some of their fears, and it goes beyond care to family social development issues. And that is even when, at that time, the conversation was around education. How do they take care of their children who are not responsive? Schools are closed, the children are at home, they're not doing anything. And parents, they're stressful to the parents, and the parents are also stressful to the children. So when you get the different dynamics, you're able to make more informed decisions, and you're more in context with the community. And I think that is the purpose of the primary healthcare internship. You'll be in touch with the community that you're serving, so that whenever a patient comes to the facility, beyond seeing the disease, you see a human being, a mother, father, child, a daughter, son, and then you're treating the son, you're treating the person. So you give them the therapeutic care, but you're also seeing them and giving them guidance to cope with the other aspects of life. Because when they come there, they don't care whether young or old you are. As young as you are, provided you are a doctor, you are a specialist in the facility, they're counting on you and they trust you by all means to give them the best advice and the best guidance you can. So you have to make use of that. And that is important for you to know that at that point, you are the authority. And as an authority, you can either make or break them. The choice is on your end. So you have to make that choice. And those interventions, when you do them, document as much as you can, and also just be open to learning. It's not about knowing everything. It's about being open to learn. And you only learn better by having the experience. And they'll give you a challenge, even after internship, the post-internship bit as I get into it. You see, there's that aspect that you say we just want to learn. There are certain master's programs that are now limiting people from just transitioning from undergraduate into master's program, because it's like you're running away from gaining the real life experience. You don't even have clarity in terms of what do you want to grow into? Why are you pursuing that master's program? It's just a way that kind of you're used to I would say the rite of passage. Nursery school, primary, secondary, university, you now want to go for a master, then after master's, probably a PhD, and all these in the hope, after this, I'll get a better job. But why do you want to do it? What particular push do you have in life that is getting you towards pursuing this particular course other than another? Or if you are given 10 courses, you'd take all of them, just depending on whichever comes first. So are you intentional about your learning aspirations? And they're looking for experiential learning. And the reason for the experiential learning and having worked practice experience years is you get into practice. One, you are working with diverse groups of people with different perspectives and from different backgrounds, which means there are certain disappointments you are going to contend with, whether you like it or not. You'll work with people who are not the kind of people you're used to working with. You'll work with people who are annoying, and you'll also be annoying to other people that they'd feel they'd fire you the first day they saw you. But then you have to find a balance, and you have to find a balance in the sense that you find ways of working with each other to meet the obligations of the company. But if you're lucky enough, you'll make friends out of these people. And if you're not lucky, you'll work with them and explore opportunities out and transition. So the experience is good for you. And also in the process of getting this experience, you're seeing the real life work, not the theory that we say from a pharmacist standpoint. Pharmacists are the medicines experts and everything. It's good to say it. And I believe we are medicines experts, but unless your expertise as a medicines expert is seen in dealing with a patient and treating someone, it will be of no value. Unless that capability is seen in formulation science or anything, then it will be no value. So can you translate the theoretical knowledge to real evidence or output in the world level? If you're able to, that would be a win for you. So experience is key. So take the time to learn and take the time to do the job, because you get the insight as much as you need. Post-internship, you're done with the internship. The first thing that happens, the tap at Ministry of Health closes. And when that tap runs dry, the pressures now start coming in, because that is when you'll start calling David you were not talking to the whole last year when the internship money was coming. That is the time you'll start visiting the village, because you're now seeing, are there any other projects that I can execute in the village that doesn't depend on me being in Nairobi? And looking at alternatives, you'll start attending HOPAC and PSK symposium, conferences, and webinars, because you're hoping something might be said and there will be opportunity that will be shared. And that dynamics is also very critical, because when you are finishing your internship, there are so many of you, and there are also more people who are out there who are still tamarking and looking for opportunities than you are. So the market is crowded. And when the market is crowded, you have to distinguish yourself, and you have to be strategic, and you have to be intentional. The first key thing, based on the particular aspect that I mentioned from the advice last weekend, when you finish your internship, if you're not so clear on where you want to put it to focus on, be open to different opportunities that may come your way. Because with those opportunities you are seeing, what can I do? How can I do? Where is my interest lying? And how do I take advantage of the opportunity that has come in that space? That is good for you. In terms of investing, I gave you the first option of the money markets and every other thing. There's this option that people say we want to invest in pharmacies and all that. It's good to invest in a pharmacy, but one thing that you need to know, even if it's not a pharmacy, any business that you are going to pump in substantial amount of money and that has a physical premise that you have to manage, bear me witness, you'll take up to 6 months without making any breaking even, minimum 6 months without breaking even. And if you're not breaking even, it means you've not even recovered the initial investment cost in that business. And it will need much of your time because you have to be the person to open it and you have to be the person to close it. Unless you have substantial buffer in terms of money that you're going to employ someone, and the person employing will also be depending on guidance from you. There's no way that you'll give guidance unless you practice and you run that business by yourself. And I give you a real example. I've been doing this. 2017, I opened a restaurant in Georgia, which failed. Then after that, I started Ryculture. We're still struggling and finding our footing as we move forward. Luckily, I did not put all my money down the drain. But there are people who have invested their money. The dynamics are not working. The market is not as good as you think. Therefore, you might lose all your money. The best thing, gain experience, venture into the business space when you've established and you're sure, I'm going to do this, and you have that commitment. And if you are committed after your internship and you see the business world is where you're going to, commit to it. Know that it's not going to be easy. You need to invest your time and your resources. You need to invest in networks to be able to get the right suppliers, manage your customers by building relationship with them, because that is what will make a difference whether I'm going to your pharmacy or to another person's pharmacy, to your shop or another person's shop, to your restaurant or another person's restaurant. So you need to know that you have to commit time and you need to do the work. If you're going the professional line for a start, look for opportunities. Get the job as you keep moving. And in getting the job as you keep moving, the job is, yes, normally working hours are 8 to 5, 8 hours a day. Out of that, you can spare 2 hours in a day. Let's say you commit to 10 hours of active work in a day. 8 hours are the job, 2 hours are for you to build yourself, professional development. Give it 2 hours a day. And if you're able to do that 2 hours a day, you are identifying your areas of interest, you're building your skill sets, and also seeing how you can apply your skill into the job that you have. And in that negotiation, still based on the pre-internship bit, negotiate for a salary that can sustain you, that can give you a decent life at the bare minimum. Don't go taking something that cannot even pay your rent. Because if you do that, the thing is, the amount of money you're paid during your internship is the amount of money you'll be drawing from. So in other words, you are clearing your buffer stock. And you're clearing your buffer stock when working, rather than when doing something else that can expose you to the next opportunity. So negotiate fairly for the market rate on what you want to get as a salary when you're post your internship. Save your salary amount and use it when necessary. But if you can avoid using it, or you can use it in other investment solutions and all that, the better for you. So that is important. After internship, get the job. Then after that internship, still build your professional profile. Do the short courses that you need to do as much as you need to do them, and they should be in line with your interests. And that is where being intentional in learning is important. Get into networks where you'll see people will talk about the different projects they're doing. Those different projects, some will be of interest, some will not be, and some will actually be what you've been looking for. Plug in and collaborate with those people in those particular lines of work and build your career based on that experience as you grow in the journey. If you're able to do that, I think the next line of our career journeys are going to be better, and we'll be able to make the moves that we need to make to be successful as professionals. And I think that is a kind of a snapshot of what it is. But basically, network, engage, be committed to lifelong learning. Yes, so I'll open it from here for the questions, suggestions, or comments, then we move forward. Or unless somebody wants a specific question in terms of my journey, because yeah. Over to you, Sylvanus.
Yes, Doc. Nice. I'd like to, I think, maybe mention this just before we proceed. I like the fact that you, I don't know if, I know I hadn't shared the questions we had received with you, but it's I'm delighted that you've managed to answer almost. I think this is all of it, because you've touched based on let's say investments, because we had a question on what investments would you recommend someone to start during internship, what circles are the best to join. But you mentioned money markets. I'm glad that you did that. And also you've mentioned the fact that we are supposed to have the experiential learning, not to kind of consider between transitioning from undergraduate to postgraduate. We had a question on what are the best postgraduate courses to take once you're done with internship. And I feel like that would, you've answered that best. I'm not so sure if the current audience have concerns. I'd like to request them to share. If you can't unmute, maybe drop it on the chat box, then we'll address it. But maybe if anybody else has maybe a direct concern, question directly to Dr. Odhiambo, please feel free to unmute and then engage. But so far, I'm pleased with how you've approached this. I think your experience personally covered most of it.
Thank
you. So let me just open the floor for the participants and then we'll see. Shannon, do you have anything? Nabila? This is also here. Okay, nice. So there's one question in the chat box from Nabila. What would you say you are passionate about?
Wow, that is the toughest question. What am I passionate about? I have so many interests, but at the end of the day, one key thing, the things that I know, my passions are in two lines: healthcare and education. And that is why with the kind of things that I'm doing, I'm either educating people in terms of the work that I do, and that is why I do my videos. And I'll urge you guys to check it out, because I talk about most of the things around pharmacy and the pharmaceutical industry, that platform. So I have an interest in teaching, but teaching people to make an impact and deliver solutions wherever they are. And in my case, being I have the pharmacy background, I'm passionate about improving access to healthcare. So how can I serve a community? How can I make healthcare services available to a greater extent? And the reason as to why I do the healthcare bit is because I have the technical capability by the basis of my training. Then the other bit in terms of education, I come from a family of teachers. So by the virtue that I've been nurtured and raised by teachers, I found myself teaching immediately after high school. So after high school, I opened a library. Then after opening the library, most of my villagers were not learning. So I had to close the library. Luckily, I was using my mom's house in the shop in the market center. Then I closed and went to teach in the secondary school next to the village. And from there, I loved educating and teaching people and sharing knowledge. So my passions are in education and healthcare, to a greater extent with alignment to improving policies, because at the end of the day, for sustainability, the policies have to be aligned, and the policies are the way that will ensure whatever David is doing as a pharmacist today is the same thing that David's grandson, grandchild somewhere will be able to do in their practice. But if they're not in policies, then when I die with it and it goes with me. So how do we ensure it's sustainable? That is my inclination towards the policy, so that we translate impact of evidence of what we're doing to inform the policy that will make it sustainable long term. Yeah. I hope that answers you, Nabila.
I had a question on when you're talking about project management, and I think the thing I picked was documentation, because that one was stuck with me, because even when I was at a community pharmacy, my superintendent was complaining that one of the problems we have with pharmacy is that most of us usually don't document. And then even when it comes to charging for a service, you cannot charge for a service if there is no evidence that the service has been provided. So when it comes to documentation, what especially for these projects, like for the case that you gave, how do you go about documenting in such a way that it's something that can be followed up?
Okay, so for me, in terms of documentation is important, and the reason as why documentation is important, there's no evidence unless it happened. Unless it documented, it never happened. Good documentation practices in pharmaceutics. So for me, in terms of documentation, what I do is, one, at the pharmacy level, most of the pharmacies that I've attended to, there were never any documentation documents. So it is your personal initiative to document. So there's some work that I'm trying to do with African Pharmaceutical Network to develop toolkits and actually workbooks that we can use to document cases with particular indicators. What am I looking for when I'm managing a project? What am I looking for when I'm treating a diabetic patient? So that those notes can be used to inform, to generate evidence, and that evidence can inform care practices as we move forward. That would be important. But in terms of documentation, for me, is you as an individual, what problem do you want to solve? You can write it even in your notebooks, then you'll type it on your laptop when you go back home. The key is, what problem are these people dealing with? And what is the problem beyond where you are? What probable solutions can be implemented to address each of the gaps in the care system for that patient? Then once you're able to do that, for me, what I did is, because I know the hospital didn't have such kind of a framework, when you go to my LinkedIn page has articles and articles. I think there are now 48 or something that I've been writing. And I started writing in 2017 after World Health Student Summit in Rwanda. And from that kind of, I've kept that trend of writing. Nowadays, I do most of the videos. I don't know if it's the writer's block or something, but I'm still doing it. And then the blog that Sylvanus has just shared, the Spark, I share more of the content in such platforms. But the key is, can you document it? Because it's your work. But if you are in a practice where you have the right over that kind of content, you have the responsibility to document it, and you can put those structures in that facility. But if the facility doesn't have the structures, write it as your information. The only thing is, don't identify the patient, because that is now kind of infringing on their privacy as an individual. So if you're able to do that, document. And then the other thing that I was doing at that particular moment, I wrote a proposal, and that proposal I sent it to probable partners, United to combat NTDs, BNDI, NTDs under the Ministry of Health. That is when I got to meet Dr. Sultani Matendechero, the current head of National Public Health Institute. And from those conversations, I was like, I need your support to implement this solution in this community. These are the data that we are getting from the patients, because now within the 2 months that I've been in the pediatric ward, I've been able to see 7 patients from the same geographical location. All of them initially were being treated for malaria. When malaria response was not there, they were being treated with flagyl. They were like, they have a GIT problem, which is not the case. This is an incidence of visceral leishmaniasis. There's an outbreak and we need to intervene. And by the virtue of that, at that particular moment, the challenge is we never got the resourcing to do the work. And the reason is why we never got the resourcing, that was a KNH initiative that would have been led by an employee within the institution, or KNH as an institution would lead that intervention. Having been an intern, then the partners were willing to engage, but it isn't within my scope to make that decision. Therefore, I transferred it back to the facility, and I don't think it ever took off from there. It died off. But that is where you need to start. By the virtue of having those connections, you can still talk to these people. You can engage with them moving forward. But on your own personal, professional profile, LinkedIn newsletters are available now. You can blog on your own LinkedIn page. You can go to WordPress. You can go to Wixsite. Create your own blog. Create the content about the intervention that you're doing and the particular changes or interventions that can be implemented in each of them. Then by documenting that, over time, you say, by the way, this is my line of work. And actually, one of the key things that I've recently been doing, I'm reviewing the content that I've been creating over time, reviewing the conversation that I've been having with people, and also the articles that I've written. Then I realized there's a common trend, and they're probably in the same line of work. Therefore, that happens to be the passion, the area of my area of passion and the area of pursuit that I'm interested in. So how do I kind of concretize and galvanize that action to see how do I make it be consistent and aligned? So that would make it easier. But the key is start by making it on your own level. That would be important. Hope that answers you, Mark.
Yes, it does.
Thank you.
Right. So maybe let's just move on to the next question. Shannon asks, international students are not paid during internship in Kenya. What advice would you give any international students who have plans of interning in Kenya?
Okay. So, well, in terms of that, I don't know how to answer it, because I have a friend actually we did internship with who was never paid during the internship period, and it was a problem. And what I would say is this is a government policy issue in terms of the resourcing, and most of the time the government is not willing to spend on non-Kenyans who are doing the internship in Kenya. And I don't think there's anything we are changing about that unless through the KMPDU, PSK and the Young Pharmacists group, that action is still taken forward. And hopefully over time it changes from a policy level within the Ministry of Health. That would be the way that they internship, the payment would come on board. But then the other question, beyond the payment aspect, which is beyond my capability to influence and also advise on it, is we engage these associations and push it. But the other aspect in terms of what are your plans as an individual, as an international student who is working in Kenya and you want to do internship in Kenya. Do you want to practice in Kenya long term? That is the first thing. What kind of experience do you want to gain in Kenya as a person interning? Because when you're not paid by the government, even your internship posting to a greater extent might not be informed and influenced by the Pharmacy and Poison Board and the ministry as much. They would give you the posting letters and they'll tell you, okay, some of them get your own facilities where you're going to do your internship, or the ministry will post you, but you're not going to be paid. Some of the time for this particular friend of mine, we did our internship together at Kenyatta National Hospital. She was not posted, but she had been listed by the Pharmacy and Poison Board in the document that was sent to the ministry. So when she went to the ministry, she was told, go find a hospital where you can do your internship and ensure you report back to us with that facility so that we capture it in our details. But the condition is you're not being paid. So you have to identify a facility that will give you the best learning experience based on what career interests you have and what kind of experience you want to do. Two, being you're doing it at your own cost, try to be able to manage the distance from where you are working to where you are staying, because that cost is going to be on you. And you also won't want to burden your parents more, your guardians who have been financing your education that much by moving to a very distant location. But if they're able to, that is good for you. But ensure it's guided in learning, because it's now you making a decision on your professional development. Then during that internship, the key differentiator for you would be, how do you transition after that internship? You know the dynamics. You have to get registered. At the end of the day, when you're registered with the Pharmacy and Poisons Board, you start tarmacking like every other person. But the difference is you're starting to tarmac like every other person, yet you don't have the buffer in terms of the internship pay that can keep you a couple of months. So you have to start looking for a job as early as possible. And that is where even the places where you look for your internship, because it's not paid, can be structured in the sense that you can even start negotiating for a job with them. You are doing your internship as a learning opportunity, but at the same time, you're negotiating for a certain salary pack so that after your internship, you can continue working at the same location. Because the government is not paying you, then can they pay you at that level? And you make it clear by telling them, by the way, this is the situation. I'm not being paid by the government. I'm doing my internship, and I would be glad if we could work on an arrangement where I can start working with you. You might not pay me the government rates, but we can work on something that can keep me through my life, give me the buffer in terms of catering for my livelihoods as I continue learning. And there's a prospect that I can even continue working with you after this period of time. That gives you an edge so that you craft your path and develop yourself. Alternatively, you can see which other countries you'd be interested in, but the dynamics of that is, if you're going to any other country to practice as a pharmacist, you need to start from the country where you trained, and you trained in Kenya. So definitely you need the basic license from the Kenya Pharmacy and Poisons Body if you've been educated and trained in Kenya. So you get your training internship in Kenya, finish, get the license, then consider options of leaving the country if you are looking for that as an option. Yeah. I hope that helps, Shannon.
Yes, thank you.
Thank you.
Right. There was this last bit. I think you've answered this. I'm not so sure if it was satisfactory. Nishat Sumra asks, can you guide me on how to publish an article?
Publishing an article depends on where you want to publish. For me, I publish on my LinkedIn page, and I think that is kind of the guides and the tutorials on how that works. If that is the case, then I can just show you a demo just quick right away. Let me confirm. The other one is on Spark. That is my own website, so blog page, and I create content on that. So would you want to know how to publish on these platforms? The alternative is to publish an article in a peer-reviewed journal. Some of them charge you a fee, but Pharmaceutical Society of Kenya, provided you are a member, you don't pay a fee. You submit to the PJK, Pharmaceutical Journal of Kenya, and they'll review. If it meets the credibility standard, then you're good to go. And there's already a guide on the website, for PSK website, that gives an overview of how to structure your guideline, all that. So, Sumra, anything specific?
Hello?
Yes. Anything specific in terms of how to publish that you'd want to know? I can hear you.
Yeah, actually, okay, I'm a student at KEMU and I've just finished my 5th year and we did a project like last year.
Mhm.
It was on COVID, the vaccine, and I'd be interested in publishing. So I'm looking for an opportunity, like maybe you can guide us.
Okay. So you want
Because
to publish in a peer-reviewed journal?
Yes.
So for a peer-reviewed journal, then what I'll do, I'll just go to the PSK website, and I know there's a guide on how to publish. Then that is the easiest point to start by doing that publication, because I know with PSK, the journal is an open space that you can use. And Obi here is also one of the members of the PSK team who would be able to give you more insight as well.
That would be great.
Yeah.
Okay.
So let me just send you the link to submit some manuscript. Any other question as I get the details?
Hi, Doc. Did you want to demonstrate by sharing a screen, or would you
No.
share the link?
I'm just looking for a link, then I'll share that.
Oh, okay, sure.
Yeah.
Right. Anybody else? If you had a concern, comment, or a question, feel free to do so. We have a few minutes to go. I think we can utilize that. But I'm so glad that you managed to create time to participate in this. As you can see, we have participants from more than one school. So far, that's KEMU, JQuat represented, which is a nice feeling because, you know, this is an opportunity we felt should be open to all as it is relevant. Yeah. So yeah, thank you for creating time. Thank you, Nishat, for joining us.
So I've sent the link. I've sent the link, so you can read it as part of the contribution. And in case you have anything you need guidance on, please reach out. I can also link you to the respective editors of the journal so that you can liaise with them and get in-depth insights. But I think it's the easiest way to publish your work before you go for the other one that are paid for, because the ones that are paid for, some of them are very expensive. Somebody tells you to pay $800 to publish an article, and you're publishing your knowledge and your own research. So the dynamics are not fair. But the PSK one, being a member, you're able to publish and you get it moving. But before even the PSK reviews and everything is adopted, you can publish in your own LinkedIn page. That is already a professional profile and it's a paper that you take ownership of. So you start from there. But that's okay for me. And just to let you know, Sylvanus Manyala, this is a good opportunity. These kind of conversations are important, and I think we need to have more of them. Unfortunately, most of the students that we are dealing with, and actually even during my school days, not most of us saw the value of these kind of opportunities, which I wish could change, because this is how you get to meet people. This is where you learn. I remember we had the JEPSA chats, alumni chats, and actually that one also died. I started that in 2019, January. And we had like 5 sessions only, then it died off because when we are hosting them, the alumni coming back and the students who are supposed to be the beneficiaries were never turning up for the activities. So you end up with an alumni and 3 people in the room. So this is the dynamics of it. Hopefully over time, when people see the impact, the stories of impact and the difference that you're making with these conversations, then more of them will engage and hopefully it becomes a sustainable thing. Yeah, but don't give up, keep at it. Yes, so that is it for me. Unless any other question.
I think. Thanks so much, Doc. I think there's one additional question. A summary of internship posting process. while you attempt to respond to this, maybe briefly also mention maybe the what we should expect in terms of the areas of attachment. Just a synopsis of I think there are 4 areas, so that we get to anticipate, and then maybe clarify on the internship posting process.
Okay, so that's interesting. The internship posting process, one, there are those from the university. They don't do stage 1 exams, so those guys will wait for the PPB to post them after the pass list has been sent to PPB. For other universities and including international students, you'll come to the country, you'll do your stage 1 exams. After the stage 1 exams, you pass the exam, you will be in the pass list. Then that pass list is going to be collected in terms of the number of people who are being posted for internship. So that is by the Pharmacy and Poisons Board first. So even the University of Nairobi, the university will send the finalist list who are going to be posted for internship to the Pharmacy and Poisons Board. Then the Pharmacy and Poisons Board, based on the timelines and actually their schedule for posting for internship, will send the compiled list to the Ministry of Health. Then under the Ministry of Health, the posting will now, with the list in place, they'll work on their posting orders. And the posting orders are based on availability of funds at the Ministry of Health. That is the first criteria they look into. 2, the facilities where they are posting you to and the need in those particular facilities. Some institutions will not be able to host more than 2-3 interns. So if they already have other interns, then they have to find a way to balance those dynamics to ensure you are not overcrowded in a single institution where there's no substantial learning, but at the same time, there's no deficit in any institution. Because ultimately, one key thing you have to acknowledge is you're not just going there to learn, you're going there to work as well to support the workforce that is on the ground. So that is important. After the Ministry of Health has worked on the list and the posting orders, you'll receive a list, and that list will be advising you to go pick your letters. Room 126, first floor, Ministry of Health, Afya House. You go pick your letter, the posting order, the dates of reporting will be established. You go report to your facility as per the date stipulated with a set of documents that you should have prepared by that time. Once you get the reporting letter from the institution, you'll bring these back to the facility, to the Ministry of Health, so that you confirm you've reported and they file those documentation. That will be what is going to inform actually the creation of a P9 form for you. So the PIN, you're creating a PIN for you, that is the KRA PIN or something, not KRA PIN. The personal number. So the personal number will be created after you've confirmed you reported to work and you've given the documents to the Ministry of Health team. So that is guiding them for your managing your payments, the payroll processing and everything as it moves forward. Then after that, you go back to your station. During that period, one thing that I would want to mention, some of us feel like we just are kids who are given orders, do this, and you do this, and you move without questioning, without asking anything. Some of the times, one thing that I noted was there were people who are having challenges in the sense that I'm posted to go to, let's say, Homa Bay or Garissa or Mandera, and I'm not able to go to that location. Please go talk to the PPB team and have a genuine reason as to why you are not willing to go to that location or you are not able to. Then once you have that discussed, you can have a change of the internship posting station. That is number 1. 2, when you're posted to an institution, when they tell you you report on this day and you, let's say, for example, for me, the reporting was on 9th of December. I'll report to Kenyatta National Hospital on 9th of December. But before then, definitely there's something I was doing. And that is what I was talking about in pre-internship. You already had something that you are doing. And the posting being there sporadic and everything, you're not sure on where timelines the internship will come. So you go report, get the reporting letter, and negotiate with your preceptor, the person receiving you at the internship site. Let them know, I was working on this and this over this period, and I'm requesting an extension of maybe a week or 2 to be able to conclude and put my affairs in order in this particular location. And even if it involves relocating from one location to another, I manage the relocation by finding a house, getting my belonging, and setting up my place before I start working. Because you need to be at your best to be able to perform at that internship station. So that is communication skill. You need to be able to communicate and relate with people. After the posting, you start your internship, the journey continues. You move from one station to the next. Then from what Manyala mentioned, the different stations, we have primary healthcare. You have level 5 or level 6 clinical pharmacy practice. Then you have industrial pharmacy practice, another 2 months. Then you have the last one, the community pharmacy practice. Of the 4 stations, there are different expectations in the sense that in the clinical setting, we're expecting you to be able to do clinical ward rounds. And in the ward rounds, you're able to review treatment plans. You're able to give guidance where there's need to. Most of our facilities are not doing these things. but we talk about them from an advocacy standpoint. So I'm urging you to be the change. But when you go to those spaces, do the work. And when you do the work, learn from them and see what needs to be moving forward in terms of your professional experience. So in clinical ward rounds, you need to do clinical ward rounds, review treatment sheets, review treatment protocols, advise and share information with the consultants, the physicians, and if possible, even facilitate some of the CMEs that are being conducted in these hospitals where you are, that is on the clinical level. When you go to the primary healthcare, we are expecting you to be a member of the primary healthcare team. The key services that are offered in primary healthcare, mostly beyond the kind of the minor curative by clinicians, you should be the medicines expert advising them from the medicine that are being used. And one key thing that you also have to acknowledge, most of the primary healthcare facilities are on overdrive. I've been prescribing amoxicillin, paracetamol, amoxicillin, aceclofenac. A patient tells you they have ulcers, and the only painkiller that is in the hospital is aceclofenac. Do you dispense the aceclofenac that has been written by the clinician or not? That is a call that you need to make as a pharmacist in that level doing your internship. And by the virtue that most of these facilities don't have a pharmacy, the primary healthcare facilities, there is the sub-county pharmacist who manages 5 to 6 primary healthcare facilities who will be receiving you and handing you over to the clinician in charge. So by that virtue, you are the most trained person in that level, and therefore you need to act like one by sharing information in a better way, but also don't be so arrogant in the sense that you feel you are the most qualified person that you make decisions. This person has been making those decisions and running the facility with or without you. And therefore, they can still do it with or without you. So you come on board, support them to make the best care for the patients, but also learn from them and advise them where there are problems in terms of their care plans. Then the other bit is the primary healthcare is education, patient, community-based program, community interventions. They're going to do, let's say, for example, polio vaccines that are led by the community, the nurse. The nurse, when they're going, can you support them and go with them just to learn and see the experience? When they're going to let's say what do you call them? The maternal care clinics and all that, family planning clinics, can you be able to work with them and see how those clinics are run? What is happening in those spaces? So you integrate in the primary care level of care. That is good for you. And also at times you'll be called to the barazas. If you're in the rural communities, the barazas where the chief will be giving guidance and all that, probably there's a disease outbreak, you are the people who are going there as experts. Be available to offer your intervention because you are integrating as a part of the community in the primary healthcare. Industrial pharmacy, most of the places that you go to would be keen on having you see the production line. It's good to see, but I don't think 2 months is enough. 2 months should be all used in seeing. Look for skills that you can learn. The company pharmacists will definitely be reviewing and developing dossiers. Can you offer yourself to support them in reviewing and developing dossiers at the pharmacy, at the office level, where they're doing the documentation? They definitely have a pharmacovigilance or patient safety specialist. Can you have a conversation with them to see what you can do with them during that period? There's a QA specialist. What can you do with the QA specialist? Don't go as a common intern as every intern goes. You'll be assigned, you'll be going through these different stations in the facility. Yes. What do you do every morning? You go there, see what the production, the first batch was being put into the what do you call them? The tableting machines and everything. Then after you've seen it, you go to the pallets and sleep the whole day, wait for lunch, go have lunch, come back. That is not going to help you. But if you're able to integrate with the pharmacist who is doing the dossier regulatory bit, doing the quality assurance work as the head of company quality assurance team, the pharmacovigilance person, the supply chain specialist, the procurement specialist, you're already building networks. Those networks, if you find something you're interested in, it's easier for them to co-opt you having worked with them during your internship than getting somebody from outside. But if you went there, just saw them, slept at the pallets, waited for the day to end, went home and came back, you'll not make value. So find yourself that you're putting yourself to use the technical knowledge you have. You know how a tableting machine works. You know how capsule making machines work. You know how let's say, for example, the friability machines work. You'll see them, yes, just to appreciate from a visual observation. But beyond that, the technical bit is in the documentation of this process and observation of what critical parameters are being looked into. Engage with the person making that decision that is doing that work after having the visual inspection and assessment. Community pharmacy, yes, it's working still. So you have to be there as well. Do the work that needs to be done, the dispensing, patient care programs and all that. Most of them actually, there's commitment and interest in the financial aspect, commercial targets and everything. The goodness is I've not had any intern who have been given commercial targets that by the end of the day, you should have sold this much. So be there as a patient. And when you're there as not as a patient, but as a specialist, as an expert, engage with the people who are working, but also look at different approaches. Can they make more money if they offer the additional quality care? And that is now where you have to make a balance. And when you make the balance, you'll be able to be a better practitioner at those levels of practice. I hope that helps, Manila.
Yeah, it does. And thank you so much for that clarification and, of course, the insights. I hope this is Joyce. Yes, I hope, Joyce, you've been answered. Now, I think at this point, we've managed to tackle the most important bits. If in case we have not responded to some concerns, I think we can always reach out, yes, Doc, maybe later on. And then we'll see how you can get responses and share this back with the participants. So thank you all for taking time. I wanted to share something briefly as we wind up. Yes, so I know, Doc, you've mentioned, and I appreciate that you've acknowledged what we are doing. This is something that I am passionate about. We're trying to revive, the association, and we're trying to also make it more impactful and relevant for our members. The first few sessions, like I mentioned, were like they had very nice attendance, okay, which was promising. I think today, maybe because we're just coming from our exams, we're still trying to cool off. But maybe for the next few sessions, we'll be having an improved participation. But this is something we are looking at just because it's one of our responsibilities. Yeah, we are a professional organization, so we are somehow obligated to have these activities that are, of course, professionally inclined to our members. So in line with that, we had done a call for alumni. This was basically for UON alumni. We're trying to work closely with the young pharmacists, for that matter, because they have the most recent experience, very raw, something that we also expect maybe to go through, assuming things don't change drastically. So this is one opportunity, and we're hoping if you know any alumni or any recent graduate, please let them know. We have an opportunity to reconnect with them. We're trying to bring them aboard so that we don't lose touch. I know we would be soon the alumni. So sharing this information with people coming after us would be very important. The whole series of the talks is to sort of curtain raise for our mentorship program. We've done the first phase of interest survey and mapping. We're trying to get to understand our students, maybe the areas of interest. I know you've mentioned that in as much as people are trying to be strategic, then it has to be intentional and, of course, in areas of interest. So in as much as we are having these general sessions, we're trying to find targeted approaches to also address. So if you have somebody who's into industry, regulatory affairs, we're trying to match them up with players in the field who are also willing to hold their hand, guide them, and let them know, okay, this is what happens in the field. So if you're interested in this area, then this is what to do. And we're hoping to finalize on this in the next few months. This is March. So by April, we're supposed to be monitoring the first phase of our mentorship, mentor-mentee attachment. And of course, we are trying to also document these. We've archived these sessions, that's why you're recording this. We'll have these uploaded on our YouTube channel as part of the playlists that we are creating on the Career Mentorship Talk series. So participants, you can revisit the previous sessions that already exist. If you want to revise this session, also we'll have it up and running by the end of today. And then you just go through the previous sessions, and then also feel free to suggest topics you feel would be relevant, maybe for future sessions. So that said and done, thank you all for making time. Thank you, Dr. Odhiambo, for being willing to share your personal story. I know you've done this a couple of times. I'm hoping you don't get tired of sharing your stories with Dr. Moniki, Dr. Wala. This is, I think this is one of the ways to inspire some of these, the next generation, let me say, me being part of it. And it's always eye-opening, because I know we are somehow traditional. We expect to come from campus directly to internship and then employed or not employed, but we fail to understand maybe there could be other factors during internship, pre-internship, post-internship that influence how we chart our professional paths. So thank you all for creating time to join us. We look forward to hosting you for the next session, which should be, of course, announced in due time. We have a session on professional development, personal branding, with Dr. Libea Bethwell very soon. So we are hoping that would also be relevant and impactful to you. So as of this point, I think I'd be right to call the session done, unless otherwise, and then wish you all the best as you go into the weekend, and happy Sabbath for the Adventists. Feel free to unmute and say goodbye. Then see you soon.
Thank you, Manala. Thank you, the team. It's been a pleasure. Have a good evening and a good weekend ahead.
Thank you so much, Dr.